Have you ever felt pulling or pinching kind of into the front of the hip or the groin when you're performing a squat? Is it at the bottom of the squat when it's really starting to pinch and you can't really get that strength you're looking for? Welcome back to the PhysioBrake channel. Today we're going to cover the main reasons of why your hip pinches when you squat. First, we really need to dive into the squat mechanics before we can understand why it's causing pain. As you can see in the squat here, what's happening is we're getting hip flexion, so the trunk and the thigh are coming closer together. We're getting knee flexion, so the femur and the shin bone are getting closer together. And we're also getting dorsiflexion at the ankle, so the foot and the shin are coming closer together. Now we have to further break it up into two phases. The first phase is the lowering phase, otherwise known as the eccentric phase. This is the eccentric phase because the primary muscles of the squat, being the gluteus maximus and the quadriceps, are lengthening while they're absorbing the load. The second phase is the concentric phase, or the lifting up or raising phase. This is when the glute max and the quadriceps are contracting to straighten the body back up. Now we're going to spend our time focusing what's actually happening with the muscles during the eccentric phase and the concentric phase, specifically at the hip joint. Here in this diagram, you can see that there's two things happening at the hip. You're getting an anterior pelvic tilt and you're getting a posterior pelvic tilt. During the eccentric phase or the lowering phase, your hip is going anteriorly, or your hip is rotating towards the front of your body. When this is happening, it's because your hip flexors are shortening or getting closer together, pulling the hip forward, while your glutes, their glute maximus, is actually lengthening. Now this is kind of where people get confused because they think that the pinching is coming from tightness of the hips, when really it's not tight because the hip flexors are actually pulling closer together. Now the second thing that happens is after you're straightening up or standing up, you're getting a posterior tilt. So the hip is actually rotating towards your back. And that's from the glutes contracting and squeezing, pulling the hips backward. Now we know the basic mechanics of the squat, but we still haven't answered our first question. Why are we getting pain? Well, there's two main reasons why you get pinching during a squat. The first one is a joint restriction. Joint restriction can be either actual changes in the joint from bony alignment or muscle tightness, so a soft tissue impingement. The second reason is you can have muscular imbalances. So we're going to talk about both of those. We're going to start with talking about joint restriction. So the first one is the bony impingement. This is the actual shape of the hip joint itself. You can have a cam impingement or a pincer-like impingement. You can see in this diagram here that a cam impingement is an enlargement of the femoral head. So it sits wider into the hip socket. And a pincer impingement is you have a wider kind of grab of the hip socket. So that can limit your mobility there. However, you can also get a soft tissue impingement. The primary causes of a soft tissue impingement is tightness in the glutes and tightness in the groin. Now, tightness in the glutes, people might be wondering, that doesn't really make sense. Why is that happening? Well, I'm going to give you a demonstration of how that actually works. Here you have my femur. Now I'm going to put my femur into my joint capsule, this pillowcase. So the joint capsule surrounds my femur. Now what happens is, let's imagine that this is the front of the femur and this is the back. If your glutes are tight, what they're going to do is they're going to squeeze on the back of the joint capsule. And while they squeeze on the back of the joint capsule, it actually pushes the femur forward. And that can cause that pinching into the front of the groin. Conversely, when the groin is tight, what they can do is that can push and onto the front aspect of the femur and drive it backwards. That soft tissue pinching can also cause limited mobility, which we'll talk to more. So the second cause of pinching in the hip with a squat is muscle imbalances. This can be a strength thing. So the glutes are such a big, strong muscle that when you're coming down during the eccentric phase, they're still slowly contracting to allow them to maintain the force so they don't just fall through the floor. And if they're too strong, well, not too strong, but if they're really strong as they are, it can overwhelm the hip flexors. Because what they're going to be doing is the glutes contracting as it comes down. They want to squeeze and then rotate the hips back down, pulling against the hip flexors there. So if the hip flexors are weak and not able to withstand that force, then the glutes can overwhelm the hip flexors. So it's not usually a hip flexor tightness, it's actually more of a hip flexor weakness that can cause this muscle imbalance. All right, so now we went through the squat mechanics. We know that joint restrictions and muscle imbalances can cause pinching in the squat. So what are we gonna do? Well, this is what. We're gonna go through a hip mobility routine that I always start my workouts with, and then we're going to go through some key exercises to add to your program to really work on the muscular balance. The half lunge to hamstring is working on warming up the glutes, the hamstrings, and the posterior capsule on the lunging leg, and working on warming up the hip flexors and anterior capsule on the kneeling leg. This is a range of motion exercise, so we're going through the motion with repetition and not holding any sustained stretch. You want to do at least 20 repetitions of this exercise on each side. The 1990 and thrust is a great way to work on the rotation of the hip. When you're doing a squat, your hip does laterally rotate each way. Now this really helps to warm up the whole joint capsule in all directions and work on any restrictions. The added hip thrust also helps with the hip flexor control and glute drive. Essentially having your knees bent to 90 degrees and you're just pivoting over on your feet. I like to recommend doing 8 to 10 repetitions each side, so a total of 16 to 20. Now we have the side squat, not a side lunge per se. The reason is because I'm thinking about dropping down into a single leg squat on the side I'm going to, while getting a little bit of a stretch and mobility through the straightening side leg. I think about this cueing to have good squat mechanics. Again, I'm doing this for 20 repetitions or at least 10 reps each side. The pistol squat is a great exercise to start working on the muscular imbalances. You're going to have one leg up in the air while you're using the other leg to lower down and touching a box. While doing so, you're going to really focus on keeping your knee nice and stable. The real emphasis here is being strong on one leg so you have that good stability and you're not shaking. 2 to 3 sets of about 8 to 10 reps. The eccentric lunge to high knee drive is what's really going to help strengthen the hip flexors to counteract that glute strength that you have. What you want to do is when you're going back into the lunge, you want to control it nicely. Make sure to have the resistance band anchored far enough behind you for good resistance. 2 sets of about 8 to 12 each leg. The penguin waddle is one of my favorite exercises for working on that pelvic stability and being able to maintain that neutral pelvis while your body is moving. What you want to do is keep that resistance band at that same distance as you waddle side to side, back and forth here. This really helps for the stability when you're at the bottom of your squat. You want to perform at least 2 to 3 sets of 30 seconds. Thanks for watching. Please like and subscribe and leave a comment below of something that you'd be interested to see next. Tune in next time.